They did that in Canada, capped the doctor's salary at $450,000. Anything they work after that is unpaid. Some doctors work 4 months and take the rest of the year off. Yep, that's so. The part people I don't think are putting together here is we're already under socialized medicine. Most nurses know that. Most nurses that understand socialism, or anybody in healthcare knows, the healthcare system itself is already under the socialized structure. It's why it gets worse and worse. It's why we have rationed supplies. The part that isn't under the full socialist communist system is the everyone having to be under one payer system. If you want to get everybody under one payer system, then you're going to deny claims. But the fact is that UnitedHealth Group has been in a public-private partnership, which means they've been in bed with the government. So the government has been making those decisions, and the top of these companies go along with it. So the government already has control of it. Let me show you. Your loved ones that were denied is because of socialized medicine. In summary, UnitedHealth Group, through its subsidiary UnitedHealthcare, has been involved in various public-private partnerships and privatized healthcare initiatives, including PFI projects, PPPs, Medicare and Medicaid contracts, and state-specific partnerships. These partnerships demonstrate the company's involvement in both public and private sectors, blurring the lines between traditional public and private healthcare systems. So it is everybody having these denial of claims, understand something. It's because of socialism. Just because the government doesn't tell you you're living under the socialized system, you should be able to look around in healthcare like those of us that work in it and recognize, no, we're not under the free enterprise system anymore. UnitedHealth Group has partnered with governments and private entities to deliver healthcare services and infrastructure in various countries, including the US, UK, and Australia. These PPPs often involve a mix of public and private funding, with UnitedHealth Group providing expertise, management, and operational services. Fascism is public and private partnerships. It's socialism. Private financing initiative projects. UnitedHealthcare has been involved in over 25 major PFI projects in the healthcare sector since 1994. These partnerships involve private companies such as UnitedHealthcare financing and delivering healthcare services and infrastructures to the National Health Services, the NHS in the UK. Some key features of these last stages of socialism include collective ownership and management of the means of production, distribution of resources based on need rather than market principles, withering away of the state and classes, increased social equality and reduced economic inequality, emphasis on social welfare and public services, regulation of key sectors to ensure social and economic goals are met. Do you know how many socialist programs we have? Our country is basically socialistic because of all the regulations. So for people that want to continue to scream, we need, that's the reason why they don't talk about taking healthcare into socialism, because it's already in socialism. People's claims were denied because of socialism, because of public and private partnerships. America's free enterprise system, the capitalist system that the socialists hate, but the socialists don't recognize that there's a difference between crony capitalism and the free enterprise capitalism. Had insurance, had the hospitals not been allowed to merge, had they not gotten in bed with the government, then the government wouldn't be controlling them. Thereby, they could be competing, which is how you have the best health care. The socialist will never tell you that, though. One of the many of the people that have spoken out that have worked at United Healthcare have outright said, or from people that worked at other companies said, United Healthcare was killing us, was just making the other healthcare companies go under because they were in a public-private partnership. So that's how much socialized medicine destroys a country. Primary stage of socialism, this concept introduced by Su Shazi, refers to the initial stage of socialism in China characterized by the coexistence of public-private ownership and the use of capitalist techniques to develop the economy. It is considered a transitional phase towards communism. Is that enough for people yet? You know, if you don't want to see it, then, because people that are communist, okay, that's a mental problem. There's nothing. Communism is what ends up always leading to genocides. Market socialism. This variant of socialism emphasizes the role of markets and private enterprises in allocating resources while maintaining social ownership and regulation of key sectors. Again, so the socialists control the key sectors. That's why you have your nursing professional organizations, your medical professional organizations, why you have so many of them. They're all part of keeping the socialist healthcare system in place while they have continued to advance their wanting to have Medicare for all, which will really, they'll take it in, because the healthcare structure itself is already in a socialized healthcare system. The last stage would be everybody being on Medicare for all, and it will be your Venezuela healthcare. Just go look and see what the hospitals look like. Market socialism. This variant of socialism emphasizes the role of markets and private enterprises in allocating resources while maintaining social ownership and regulation of key sectors. It is often associated with democratic socialism. Can we say Bernie Sanders? And it is seen as a more pragmatic and reformist approach to socialism. Communism. According to Marxist theory, socialism is a transitional phase between capitalism and communism. Communism is characterized by complete abolition of private property, the state, and classes. It is a stage where the means of production are collectively owned and managed, and resources are distributed based on need rather than market principles. Slavery. Higher phase of communism. This stage is described as a society where the state has withered away and people have become accustomed to observing elementary rules of social life. There is no need for exact calculation or distribution of products, as each individual takes freely according to their need. So again, I know I read this, but in summary, UnitedHealth Group, through its subsidiaries, and that CEO that was killed, he was with one of the subsidiaries, has been involved in various public-private partnerships and privatized healthcare initiatives, including PFI projects, PPPs, Medicare and Medicaid contracts, and state-specific partnerships. These partnerships demonstrate the company's involvement in both public and private sectors, blurring the lines between traditional public and private healthcare systems. So sadly, what all of those misguided, really criminal politicians that are saying and screaming and using this opportunity that they think is an opportunity to scream for Medicare for all, they want to worsen your healthcare system, because your loved ones were denied because your insurance companies were not operating under a free enterprise system anymore. They were operating in a collaborative public-private partnership with the government making the decisions. That's fascism, baby, and socialism. That's why your loved ones were denied. Socialism is why.